We are back with part 2 of the Morning Exiles podcast, the K&B podcast, whichever. If you're watching us on YouTube live right now, it's the Morning Exiles podcast. You want to catch this one or previous podcasts, we have them archived on YouTube as well. Look for the K&B podcast, like the sign.
And again, we want to tell you we're devoting some time to things in Baton Rouge that have changed as a preventative to spreading the coronavirus. We are at La Divina, but you cannot dine in with us as you normally do. But that doesn't mean you can't have a great La Divina breakfast or a latte or some gelato. You need to call the takeout number, 225-771-8488, and they will bring it out to you, or you can wait at a table outside. You can eat it at the table outside, but it's all takeout right now at La Divina. So 225-771-8488. Joining us now is the Chief Administrative Officer for the City-Parish, Darryl Gissel. He is no stranger to you. He's been on our program many, many times. And Darryl, interestingly enough, just left the drive-thru coronavirus testing station, which is at the Baton Rouge General Mid-City, and it's unique. It seems to be functioning well. Tell me what's going on there, Darryl.
Well, the basic concept here is the medical community in Baton Rouge has all come together, which is amazing for it to happen in the city. All the hospitals, they have tried to set up, set up the testing facility so that people who may have the virus aren't contaminating other people in waiting rooms within the hospital, et cetera. Mm-hmm. So if you think you have the virus, the protocol is to actually call your physician. The physician will give you orders if they think you need to be tested to go to the central testing center to be tested. Yesterday, the center opened. It's open in the afternoons. Right now, I think the hours are 1 to 3. Yesterday, in that short period, they conducted 183 tests.
Wow. That's a lot.
Now, and, if you will hold your thought, from the press conference yesterday, we have Dr. Catherine O'Neill. Mm-hmm. She is a very eminent infectious disease specialist. She's on the LSU faculty, as well as a clinician at Our Lady of the Lake. And here's what she had to say about coronavirus and detection.
Basically says, if you feel like you're sick, don't do the ER.
As the mayor stated, we want to make sure that everybody understands that they must seek care through their provider by calling their provider's office and asking for an order, a televisit, or a visit with their provider. They have to have an order to come to the testing site. Call your doctor's office for instructions on how they would like to assess you, and they will give you instructions on the testing site and whether you qualify for an order for coronavirus testing. Those patients who qualify for orders for coronavirus testing will be those patients who fit the criteria set forth by LDH and the CDC for coronavirus. We will not be testing and strongly discourage the testing of asymptomatic patients at this time, as testing supplies are limited. We would like to triage and treat and test those patients who are exhibiting flu-like symptoms and have been ruled out for other causes of those flu-like symptoms.
And there you go. The thing is, we also have flu going around. So
yes.
You may have just the flu.
Right.
You may have coronavirus, but the thing to do, don't go to the ER. Go to the mobile, the drive-through testing facility.
What they want people to do is actually a little different than that. They want people to call their physician first. The physician will screen them actually over the phone to let them know if they need to come in or if they need to be tested. If they need to be tested, they will give them a physician's order to go to the testing facility. So the concern is we don't want everybody rushing to the testing facility thinking they can get tested. They have to have that doctor's order.
So doctor's order, I imagine, can be written like on a prescription pad, or can the doctor actually text it to your phone and you can show that?
I think they're doing it electronically so that people don't have to come in. There's been a big question. We know in Baton Rouge we have a number of people who don't have insurance. Excuse me. For those people, the directions are to call 211, and 211 will give them instructions on how they can get connected with the physician. We have FQHCs, which can provide health care for people at no cost. If someone has Medicaid, there's a number on the back of the card that they can call. So we're trying to make certain that even if people feel like they don't have a physician, they don't have access to insurance, there's still a way for them to get that order put in place.
I was a little surprised at the press conference yesterday and offended, quite frankly, by a reporter, and I don't think it was somebody from Baton Rouge, who asked, what about the uninsured? Will they be turned away? We don't turn anybody away in the time of a
Since
health
when did
crisis.
that happen?
I was offended by that question.
Right. But again, we've tried to stress, we wanted to make certain in our operation that people who are uninsured knew where to call. And again, 211 is what's set up, and they're versed in telling people to give them phone numbers on where they can call and where they can go to.
Now, Ascension Parish has a case that they have confirmed. I believe it's being treated by Our Lady of the Lake Ascension, right there at Highway 30 and I-10. We still don't have, thank
not.
God, any confirmed cases of coronavirus.
And people asked yesterday, well, do you know how many people, do we have people who we suspect of having the virus? Those numbers are not really released. I mean, the testing procedure takes 3 to 5 days in order to get the results back. So that information is being handled by the laboratories.
I have noticed that some news media, and I'm not going to point any finger locally because I don't think I've heard any local news media use this phrase, but some are reporting on presumptive cases as opposed to confirmed cases. And I think presumptive cases, that's kind of irresponsible. You could be scaring people.
Right.
This virus is certainly serious for people who have a compromised immune system.
Absolutely.
Whether it's because of their advanced age or some pre-existing condition. What you heard of a man in, I believe, the state of Florida that was only in his early 20s that died from coronavirus, but he also had leukemia. And most of the people so far, God rest them, that have passed away have had some other factor, health factor, that's been very serious. So,
and most people, they say, who contract the virus will have, in some cases, very little symptom. It's very mild. In some cases, like the flu, maybe even a little milder, so you may not even know that you have it, but you are contagious. So that's the reason for all the social distancing and closing down activities.
Which is a great word, isn't it? Social
It is,
distancing.
and I think people need to understand shedding virus. All right, so generally speaking, this has a longer gestation period than the flu.
Right.
All right, the flu, if you're exposed and you're going to get it, it's 3 to 5 days. This can be up to 25 days from what I understand. But before you start to get that fever and feel other symptoms, in your droplets from your nose, from your mouth, there is live virus that can affect somebody. It doesn't last long on a tabletop. If you cough on a tabletop, unless somebody puts their hand in it and puts it to their face, within 30 or 40 seconds, chances are they're going to be okay.
Right.
But that's why you want to stay 6 feet away.
And that's why they say to keep from rubbing your eyes and putting your hands on your face.
Don't touch your face.
And you're shedding virus, meaning there is live virus in your droplets 2 to 3 days before you feel it. So just because you feel fine doesn't mean you don't have live virus that you can pass to somebody. Which is, I noticed last night on Channel 9's news that Greg and Elizabeth, who is pregnant, by the way, are now about 7 feet apart.
Right.
That's the first night they've done that. Mayor Cantrell in New Orleans, when she had her press conference, she you people are too close together, and she moved them apart.
Yeah.
And I would assume that Mayor Broome is going to do that in ultimate conferences.
I think everyone is attempting to follow that.
Yeah.
Sometimes we all forget because we're so used to not
Darryl,
practicing that.
Talk a little bit about the cooperative effort that occurred to bring this drive-through testing facility in.
Again, amazing. I mean, we have a large medical community, and we know that there's a lot of competition within the health industry. I've been a part of those conference calls with those hospitals and the doctors. It's amazing to see what they've done to build this.
Yeah, well, I really do think, since we pulled together the concept of district in Baton Rouge, and that's been a little over 2 years now, that we do realize that while the hospitals on a daily basis are competitive in terms of their science and their staff and which doctors are affiliated with which hospital, when it comes to something like this, they all talk to each other. They probably started talking to each other before all of us started talking to them.
It's real unusual, and we had a conversation about this yesterday. The mayor has a healthy BR initiative, so the hospitals are all connected. I mean, it's very unusual for this to happen, but we are fortunate that They're all connected, and they've been meeting not just on this, but on a regular basis, providing programs to help improve health within the community. So this has been an ongoing dialogue that's gone on for years now, and this is what we see as a fruition of that effort.
Well, and I think it bears saying that we do have the largest in-bed hospital facility in the state with Our Lady Lake Regional Medical Center. It is the biggest.
Right.
And they are prepared to do some extraordinary things if necessary. They can convert a number of rooms into isolation rooms very, very quickly. We also have, out at the airport, the multiplex complex on the northwest side of the airport that can actually be turned into an emergency evacuation center, stocking center, staffing center, and that's ready to go at a moment's notice too.
Well, and we've also done things. The first responders have been concerned. Let's say if a first responder gets the disease, the virus, they don't necessarily want to go home to loved ones where they could contaminate them. So we do have set up isolation rooms. They're prepared for first responders also, should we need that. There's an awful lot of preparation that's gone into this.
People need to understand, and I know there are a lot of people that have a level of being a little bit scared, and it amps up, particularly if you've got an elderly person living with you.
Right.
Or let's just say, you caught a bad hand and you got cancer and now you're in the chemo phase and your immune system is very compromised. A lot of people are very, very frightened. But I want you all to please follow the instructions of the governor, of the mayor, of Dr. O'Neill. Call your physician from home or wherever you are. If you dial 911, they will send an ambulance. But then that ambulance has got to be out of service while they completely disinfect it. If you go to an emergency room, that portion of the emergency room is going to be out of service. So please don't do that.
And again, even if you go to EMS, they're going to take you to an emergency room. And that's, again, not what you want to do.
Yeah, please don't do that. Talk to your doctor first. And if you don't have a doctor,
call 211.
Call 211. They will get you a phone number of a doctor who will talk to you.
Interesting.
And also, if you have a friend or a neighbor that you think needs advice, give them that same advice. Urge them to call and make sure they're taken care of.
So, Darryl, as of now, from a City-Parish standpoint, what is shut down, what's canceled, what's postponed?
Public meetings, over a certain size have been canceled. I think the Planning Commission canceled their meetings yesterday. The Metro Council's canceling their upcoming meeting. We know the legislature's closing down. Prison, you can't visit someone in the prison. You can't visit someone in juvenile services. The libraries have had limited, they've changed their hours. I think there may be some more changes coming in that today. We're trying to keep basic services up and going naturally. Today we started at City Hall screening people coming in and out of the building, and we'll be doing that at other public facilities. More of that will be ramped up today.
Now, people that have things, and again, I can understand why you would want to postpone these. Let's see, a wedding. You're going to have all your elderly relatives, they're going to be there. So you really, you can't even have something that's as beautiful and fun for most people as a wedding reception right now, because it's just too dangerous.
I have a friend who said over the weekend that she thought she may have to cancel her son's wedding, but they were trying to keep the crowd under 250. So now that those numbers have been
50,
reduced, that's another issue.
Yes. But I mean, even for example, like
graduations, all the school proms, all of those things are an issue.
La Berge, which has big event spaces. Now the casino part is closed, but even their event spaces, they can't have anything that's over 50 people, right?
Wow. I have a friend who just had surgery yesterday. I was going to go visit her in the hospital. Do you know anything about hospital visitation?
Well, hospital visitation is very tightly controlled, too. They're going to take your temperature for the most part. They're going to ask you the 4-part question. I think some of those questions are even very restrictive, saying, have you been to Orleans Parish? Have you been to Jefferson Parish? They're trying to make certain that people aren't coming in who are coming from
in risk areas.
Yeah.
Well, I actually went through the screening yesterday to go to the mayor's press conference, and it was a good, thorough screening. EMS conducted it. They took my temperature to start with. Then they asked me if I'd traveled outside the country in the last 60 days. They asked me if I'd been to any of the hot spots of coronavirus, and they told me they could define them for me if I didn't know what they were.
Right.
They asked me if I'd been exposed to anybody who was ill in any way in the last 7 days. You know, it was quick, but it was very,
Right.
very thorough. And if you can get through that screening, then you're probably not worried. They're probably not worried about you. But that's the same thing you're going to be doing at the hospital where you're going to visit your friend.
Yeah.
So what we're doing at City Hall, for instance, if you come in and you fail the 4-part test, we're giving you a phone sheet with all of the departments so that you can call directly. You can handle your business over the phone. Again, we just don't want people coming in that are creating a risk.
I think that we've been very, very fortunate in East Baton Rouge Parish, but I also think the science behind what the doctors call flattening the curve is working.
Right.
It will be an absolute miracle of probability if we end up with no cases a week from now.
Exactly.
But the thing is, we're going to have very, very few cases if we keep doing what people ask us to do.
And that's what the mayor stressed yesterday. It is being responsible.
And speaking of which, one last soundbite from Mayor Broom. This is from yesterday's press conference when she addresses she's basically asking us to voluntarily not assemble, not have block parties, not get together in big groups. This is Mayor Broom from yesterday.
Don't have these large gatherings. I don't care who you are. You're making our population vulnerable. And so that is the message. People should not be having it. If you see someone that you think is getting ready to emerge with a big party or something, let us know. Let law enforcement know. And I believe as we continue to move forward in addressing this COVID-19 issue, that you will see a stronger effort of enforcement.
There you go. Now, I wasn't in the room. Bill, Darryl, you were in the room with the mayor. She sounds a little agitated.
Well, it was interesting. There was an employee who came into City Hall today when I was there when they were starting the screening, and she told me she just wanted to thank the mayor for her passion in terms of trying to make sure that people understood they had to take personal responsibility. And I think the mayor was when she kept being asked the question about, how are we shutting down groups? I think there were 1 or 2 groups that had large celebrations, and they were trying to hammer on that point, and the mayor was really agitated by that, saying it's about personal responsibility and trying to make sure that people get the correct health access.
Yeah, I that agitated her. Quite frankly, it agitated me because they kept asking a question that was not relevant at that particular point. Now, for the rest of it, both she and Dr. O'Neill made very, very valid points that it is up to us to keep this from getting to be an extremely critical situation.
Absolutely.
And I don't think anybody has ever doubted that. Now, what I think, Darryl, you and the council and all of us are going to have to do 5-6 weeks from now is we're going to have to figure out what the true financial impact has been.
Wow.
And we know it will be huge across the board.
Yeah.
I mean, if just to realize, and this is horrible to talk about public revenue, but City-Parish, our basic operations come from sales tax revenue. So as businesses suffer from people not being able to come in, local government services will suffer too because it's going to reduce the funding that we have.
Well, and I'm going to assume that over at Visit Baton Rouge, they are probably postponing large gatherings, and so there's that hotel-motel tax, which funds a big part of that operation, and a little of it goes to the city as well. I heard that the state is losing $1.4 million a day starting today from the casino shutdown.
Revenue, right. And we lose those same dollars also because we generate revenue from those casinos.
And it's going to be the actuaries and the accountants, and I think the people at the state are going to have to come in, and the feds too, and say, look, all of you folks that are hourly workers that are not getting paid right now, we're going to try to help you out. I mean, the big thing I worry about is the people in the service industry, in big service industry cities like New Orleans, and to a lesser extent, but still prominent in Baton Rouge.
Right. Exactly.
They're going to lose a lot of dollars.
And many of the people in the service industry are people who really, they need those dollars. They don't have large reserves in their pocket or in their bank.
Well, there's a lot to this. It is a complicated problem. I was telling Karen last night. I said I'm absolutely amazed that, thank God, and knock on wood, we don't have a confirmed case. But I'm going to guess at your mobile testing station, your drive-through,
Right.
once you get to 300 or 400 tests that are
You're gonna
completed,
find one.
you're going to find
Right.
4 or 5 cases.
Right. And in the mobile drive-through, just so people understand, again, you have to go there. You have to have a doctor's order in order to get in. The testing procedure probably takes 45 minutes, so it's very efficient. I mean, in many cases, it would take you longer to go to a doctor's office, to go through a doctor's visit than that. There were only 11 people who showed up without a doctor's order. That's been one of the great concerns, that we were going to have a large number of people who went there just
Sure.
thinking they could get tested. So, again, they have to have a physician's order.
And again, you can get it electronically from your doctor, and the doctors know where to send it, or they can send it to your
Right.
phone. And if you don't have a doctor, call 211. They will hook you up with a phone number for a physician right then.
Right. And we all have technology, but we have to acknowledge that we have a large part of our population that doesn't have access to all of the things that others may have. So that's the beauty of 211. 211 will help direct anybody if they don't have a computer, if they don't have access to all the electronic options that we may have.
Well, we appreciate you being with us.
Darryl
Thanks.
Gissel is the Chief Administrative Officer for the City-Parish, and we know it's a very, very busy time for you all, and we appreciate the time that you took out to talk to our audience. By the way, we are live at La Divina. La Divina's dining room is closed in hopes of not spreading this virus. However, they are open for takeouts. Call them at 225-771-8488. That's 771-8488. They'll have your food ready for you when you get here. You can eat it out on the outside dining area if you wish, or just
The patio,
drive away
yeah.
with it. You can either come in, fetch your takeout food, or even make arrangements for them to bring it outside to you. So remember, La Divina, 771-8488.
Please be safe, be prudent, be sensible, and let's take care of each other and make thing kind of quickly, okay?
Yep. God bless, and we'll see you on Friday morning. What effect is the coronavirus having on the entertainment industry? That's coming up on Friday.